Okay, sorry to keep you waiting there. You're here for your appointment with our cardiologist today. Excellent. So let me just get you checked in here. Can I get your last name, please? Okay. Perfect. You're right on time. Just going to verify a couple things with you, if that's okay. Just going to get your phone number. Perfect. Date of birth, please. Excellent. I'm just going to ask you a couple more questions before you go in for your appointment, okay? All right. So, are you on any medications currently? Okay. And any allergies that you're aware of? No? And have you ever had any concerns with your heart before now? Okay. And you are being referred by your general practitioner, your regular family doctor? Okay. And what was his name? Okay. And what were your major concerns here today? Yeah? Oh, that's okay. Don't worry. Let's talk about that a little bit more, okay? Just 1 second. Oh, it's okay. Alright, don't worry. Some people have not been to a cardiologist before, and that's perfectly okay. And it's nothing to be scared of. It might be brand new and overwhelming, so just first off, just take a couple breaths with me, okay? It's gonna be just fine. Alright, let's go. Do a good breath in. Ready? Hold it just for a moment before you let it back out again. Alright, we're gonna do that one more time. Breathe it in, hold it, and let it out. You can keep doing that. Just for a moment, okay? Now don't you worry, it's gonna be just fine. I'm your nurse here to help you today. I'm just gonna check you in. We'll give you a little checkup. Don't worry, okay? Our doctor is very, very experienced, very used to all these things. So you've got nothing to be worried about. She will tell you everything that's going on. If you've got any questions, let her know, okay? She's going to take really good care of you. All right? I know. It is really nerve-wracking, especially when you hear things that you don't know about. Like, it sounds like in your case, your doctor noticed a little bit of a heart murmur, and that's just what we're going to check out today. So don't worry. There can be many, many reasons for heart murmurs. We're just going to do a thorough exam, check everything out. Our doctor will let you know if there's anything that she's worried about. But right now, I know it's a little hard, so let's do that breath one more time, okay? It's going to be just fine, okay? Breathe in, hold it, let it out. Breathe in, hold it, and let it out. You are doing absolutely perfectly, okay? You're doing great. Just get comfortable. I'm just going to ask you a couple more questions and then we'll check you out again, okay? Alright. Let me know if you get feeling lightheaded or overwhelmed. If you need a glass of water, I can get you anything, okay? Okay, sweetheart. Don't you worry, it is definitely overwhelming being in a specialized doctor's office for the first time. I can appreciate that. You're going to be just fine. And if you need anything, I truly mean it, you just let me know, okay? Okay. Alright. Now I just need to know if you have any family members with different heart conditions or even any other health concerns that you know about from either your mother's or father's side. Alright. Yeah. Yeah, strokes aren't very uncommon these days. It's something that we do like to note about in your family history as well. Yeah. And so you said it was on your mother's side for the most part? Yeah. And do you know if any of those relatives have been put on medication for their conditions? So did you come in with any specific questions yourself today for a doctor? Anything that you were feeling in your own body, anything that your other doctor might have mentioned. Just wondering about how you're breathing and how your heart sounds. Okay. Is there anything you want me to be aware of before we start? We're just going to do a brief checkup here, get everything all set before you go to see your doctor. Okay. Just going to write a quick little note here and I'll be right there. Here, I don't coming right in. So we are, again, just back it up for a moment, we're talking about heart disease. So your cardiovascular system, obviously that's important all over. I'm just do a quick check here, just have a little look, just so nothing else catches us off guard here. All right, the major tests I will be leaving for our doctor. I'm just making sure that everything outwardly is looking okay. So I do have just a special little tool here. Just going to put that on your finger. That's just going to tell us how oxygenated you are. So it just slips on just like that. Yep, pinch. And I'm just going to write that reading down. Looking perfectly normal. Everything's looking good. Just going to take that off. And the next thing we're going to do is I'm just going to grab my cuff, just put that on, and this is going to be for our blood pressure, okay? I'm just going to take that reading a couple times, and I'm just going to write those down, okay? Gonna do our second. You'll feel kind of that pressure on your arm here, perfectly normal. Okay. We're just going to do one more, so we're going to get an average of 3, okay? Alright. Perfect. Let me take that right off your arm here. Alright. So, for my end of things, that's kind of the big stuff that I'm going to do here for you. But I just want to take another moment, if that's okay. Got a little time before our doctor's ready. Just want to see if you need a little more time to relax. Okay, yeah, I'm here for you. So we're going to go back to our breath and we're going to work from there. Okay, so big breath in, hold it before you let it out. One more time, give me that big breath in, hold and release. Kind of picture those ocean waves rolling in and out. One more time in and out. So keep doing that, and I'm just going to just do a couple pressure spots on your face. That will help. Yeah, keep you breathing. Relax. They're really good pressure relieving spots here. Just going to press in a couple different spots. Yeah, keep doing your breathing just like that. I'm just going to go just to the side here a little bit. Here. And over here. Same thing. And just going to go to your clavicle, just your collarbone. Just kind of wiping over top of it very gently. Yeah. Okay, and just the pressure spot just on the back of the shoulders. You're doing an awesome job with your breathing there. Okay. While you're doing that, I'm just gonna feel what your pulse feels like right now. That's perfect. Okay. Keep your breathing. I'm just gonna go over a couple of things that the doctor's probably going to do, just so you can have some time to think about them. If you have any questions, ask me now. go right ahead. So we're probably going to be looking at a couple things. She'll have a really good listen to your heart with her stethoscope. I know you've had that done already. We are going to connect you to an EKG. So that's just where they have those little lines that's kind of attached to your skin there that help us see like the electrical rhythm of your heart, just to look for any changes in the normal heart rhythm. Does that sound okay? Yeah. And then probably they will do an ultrasound of your heart too, if that's something that they're wondering about. It's like in echocardiogram is our big word for that. So kind of they've got a little probe that shows a video of your heart. It's kind of a black and white image. Sometimes it can have some colors if they're getting really high tech with it. So it kind of can show you the blood flow if they have the colors in there. But that way they can see kind of the size, the shape of your heart, what it's doing. They can do different measurements that way. So those are some of the things you might be able to expect. Does that all sound okay? Awesome. All right, I see you're still doing your slow and easy breathing. That's beautiful. Is there anything else I can do for you? Oh, you're feeling better? Awesome. I promise this will be just fine. If you have any questions, come find me. We can go chill out anywhere if you need a little break from the exam itself, okay? I think you're going to be just fine. Okay. I'm going to go make sure our doctor's all ready for you. I've got your file all set. All right, you just rest and we'll get you into the exam room in just a moment, okay? All right. Hi, I'm Dr. Ray. Thank you so much for your patience. Thanks for waiting there. So I think I've got everything all set out here for you now. So this is your first time to a cardiologist, that's right? Yeah, don't worry. I know that my nurse was telling me that you were a little bit nervous. Perfectly understandable. Please let me know if there's anything that is uncomfortable or stressful by any means, and we'll take a step back, okay? So I was just checking out your chart here, and it looks like your referring doctor was concerned possible heart murmur. So that's what we're checking out here today. Do you have any questions or concerns yourself? I'm just going to ask you a couple more questions. I know that we already asked you a little bit out front, but just want to know if you're noticing anything different with your breathing. Have you had any shortness of breath or any coughing? Any changes of that concern? No? Okay. And I guess my other question from there would be if you've had any dizzy spells, feeling faint, needing to sit down, anything like that? No? Okay. Pardon me. Okay. So first things, I'm just going to start out really simply. If I can have a little listen to you. So just my regular stethoscope, just going to place it right over your heart there. Have a listen for that murmur and see if I can appreciate it, and also get your heart rate as well. Okay. And we're just going to count right here if that's all right. Okay. Just going to do one more listen here. Okay. Just gotten your heart rate there, and I'm just going to have another listen really carefully, okay? All right, thank you. One last thing, if you could do for me, I'm just going to get you to take 3 big breaths, okay? So, all right, perfect. You just go right ahead there. just going to move over to this side. Perfect. One more. Okay. Excellent. Thank you. So your heart rate is elevated, and I think it is because you are nervous to be here. I think you've got a bit of anxiety about this whole situation. Is that right? That's just fair. That's fine. Don't worry. I think we're just going to take a moment just to do a couple relaxing techniques. And we'll have another listen there, see if we can calm things down a little bit. On first go, your heartbeat is quite rapid, but I'm not hearing a murmur right now. Okay, so we're just going to do a couple calming techniques, have another listen, and go from there. Okay? All right. So, this might seem a little strange, but I'm just going to start out just with my pen, and I'm just going to get you to follow it, okay? So, looking to the left, looking to the right, back to center, up, and down. Same thing. Looking to the left, the right, back to center, up, and down. Can we do one more time? Perfect. All right. This might seem a little strange as well, but I'm just going to get you just to follow the pen kind of in a random assortment now. So just follow it. Good. That's perfect. You're doing so well. Okay, excellent. I'll do the same things with my hands. So, following this finger, following this finger. And now just relax. You don't have to follow unless you want to. But just breathing nice and easily. Imagining the perfect day. The most relaxing place you can imagine. Maybe that's on a beach with clear waves. You can see the bottom. You can see the sand. Maybe it's in a grassy field with blue skies above, with a perfect breeze, the right temperature, just blowing gently by. Imagine that perfect, relaxing place. Keep imagining it, and keep breathing gently. And I'm just going to have another listen here, okay? Keep that nice, easy breathing. We're just going to have another listen. You're doing perfectly. Your heart rate has come down just a little bit. Things are relaxing just a little. So well done, well done. Again, I'm not picking up any signs of that heart murmur. So I just want to complete our complete cardiology exam. So I don't miss a thing here for you, so I can give you that clean bill. Is that all right? I think that our nurse already spoke with you about some of the things that we would be looking at today. So certainly we'd be thinking about an EKG and electrocardiogram. We just have a couple little nodes that we're just going to place on your skin to give us a reading there. And that's just to look at the electrical output of your heart to see if the way that those electrical impulses are going through all parts of your heart are looking well within normal limits. Okay, so for that, just got to take like a little sticky back off these. I'm just going to stick kind of on your 4 quadrants here. So one here, one here, and the last one here. And what we'll do, alright, it's reading right now, so I'm just going to have a little eye. It kind of looks like those little spikes that you see there. Your electrical impulses in your heart, perfectly normal. I'm just going to print off a little reading there to have in your file. Perfect. All right, I'm just going to chuck that all in your paper file here, and we'll submit this back to your referring doctor, okay? So let me take those off here. I'm going to take off the bottom one, and that one, and that one, and that one. Okay. Perfect. So that tells us, again, a lot of that heart function activity is looking perfect. So the next thing I want to look at, rather than the electrical side of things of the heart, is actually the physical structure and the movement of blood in the heart, because that's really those big cause of those murmurs, right? Any changes. So the heart kind of has those 4 chambers, right? So the top 2 and bottom 2, and we've got valves between those, and we also kind of have tubular structures that are connecting them as well that have valves. So what we want to make sure is that the valves are looking okay, that kind of the walls of those heart chambers that separate kind of like the ceiling and walls, if you will, don't have any defects in them. Holes are such that are allowing blood to go through. So let me explain that a little bit more. It's just that the heart murmur that we're wondering about, normal heartbeat sounds, we might say is like a lub, dub, lub, dub, lub, dub. As those heart chambers are contracting, sometimes if there's a little bit of blood that's allowed to squirt through a hole or through kind of some valves that aren't quite together, can allow a bit of an extra sound. So imagine the sound if you're like squeezing something that has a little hole in it, there's going to be a little bit of a turbulent noise. And that's what we can hear with the heart. Say, you might hear a lub, 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 for example. For you, I'm not hearing anything right now. You've got the nice lub, dub, lub, dub, lub, dub. So don't worry. I just want to make sure everything looks okay, because we want to make sure that you are in your absolute best health. Okay. So for this, what I'm going to do is just turn on it's an ultrasound, what the echocardiogram is. So I've got kind of like a stick here that I'll be putting right on your chest that will allow me to see through and looking at those structures. So you can also check out, if you want to look over here with me, we can look at that together. I'm just going to put a little bit of gel right on your skin there. All right, so that I can put my probe right on it. Perfect. Make sure we need that gel so we can see through. Okay. I'm just going to be looking over here just to see what everything's looking like. So you can see with me if you want. And if you'd rather not look, that is fine as well. But we can see those perfectly normal looking valves. If I change those settings a little bit, I can actually see the blood flow through the different chambers through those valves. And I'm not seeing any regurgitation or that backward flow of blood anywhere. We can look at actually the size of those chambers. It looks perfectly normal as well. And just gonna look from the side here as well. down. And we'll just a little wipe here, get off that gel. Okay. All right. So that way we'll also submit those images as well as the report here to your doctor. So in summary, you look like you have a very healthy heart. I'm not hearing, seeing, or noting any changes in it through any of our tests. So I'm suspicious for you that what we're seeing is, it's strange enough, but sometimes anxiety can cause heart murmurs. So certainly we talked about those structural changes. There can be changes, even certain kinds of activity, exercise can cause people to have these transient or short-term murmurs. So your heart murmur that we're hearing is completely innocent, benign. I'm not hearing it today, so it might be something that's transient as well. Maybe with your relaxation techniques also helped calm some of your anxiety too. So what I would recommend is continuing your relaxed breathing, kind of meditative thoughts. And I think you should also check out ASMR videos online. Those can be incredibly relaxing for people, especially for anxiety. They've been instrumental for many people, even for things like insomnia, just relaxation, anxiety. So maybe that would be something worth checking out. Okay, so we'll get you all checked out here. We'll send all your information on to your doctor. But at this point, no concerns about your heart. Things are looking great. Just work on your relaxation, okay? All right, thank you so much. It was so nice to meet you. Okay, we'll see you. Bye.